Today we are going to talk about something that can be a bit uncomfortable, but is super common, hemorrhoids. Don't worry, we're going to break it down in a way that's easy to understand and, more importantly, easy to manage.
It's Dr. Victoria and George.
So what exactly are hemorrhoids? Well, hemorrhoids are like little cushions or blood vessels in the rectum and anus that everyone has. They help control your bowel movements, but sometimes these blood vessels get swollen and inflamed, which is when they start to cause problems. This can happen from things like straining or pushing hard during bowel movements, sitting on the toilet too long, or even from pregnancy. Taking your phone to the bathroom is the worst. You spend more time sitting on the toilet if you have your phone with you, don't you? The longer you sit there, the blood pools at the lowest point, your tush, and can lead to developing hemorrhoids. Keep it as quick as you can to keep these from starting in the first place. There are two main types of hemorrhoids, internal and external. Internal hemorrhoids are inside the rectum, so you usually don't see or feel them unless they start bleeding or prolapsing, which means they come out a bit. External hemorrhoids are under the skin around your anus, and they can be more painful, especially if a blood clot forms, and that's a hard chunk of blood that collects there. Now, how do you know if you have hemorrhoids? The most common symptom is painless bleeding during bowel movements. You might notice bright red blood on the toilet paper or in the toilet bowl. Other symptoms including itching, discomfort, or a lump near your anus that might be a little sensitive or painful, and usually a little squishy. So if you're experiencing these symptoms, do not panic. Hemorrhoids are very common and usually not serious. But if the bleeding is heavy or doesn't stop, or you're in a lot of pain, it's a good idea to see your doctor. So let's talk prevention and treatment. The good news is that there are a ton of things that you can do at home to manage and even prevent hemorrhoids. First, you want to make sure that you're getting plenty of fiber, about 20 to 30 grams a day. This can help keep your stools soft and make bowel movements easier. Foods like fruits, vegetables, and whole grains and beans are all a great source of fiber. Don't forget to drink plenty of water. You want to aim for about 2 liters a day for women or 2.5 in men. You want half your body weight in pounds in ounces of water. So if you weigh 170 pounds, you want at least 2.5 liters of water. You do not want to strain. When you're in the bathroom, try not to strain or sit on the toilet too long. If you're constipated, consider using a stool softener to make things a little easier. And good grief, leave that phone alone. Regular physical activity can also help keep things moving along in your digestive system and prevent constipation, which is a major cause of hemorrhoids. If you're not getting at least 150 minutes a week of huffing and puffing, well, what can you start doing this week? I know you can think of something to get your heart rate up. If you already have hemorrhoids, there are some over-the-counter creams and ointments like hydrocortisone that can help with itching and discomfort. But remember, especially for something like preparation age or steroids, we do not want to use them more than a week at a time unless your doctor says it's okay. Steroid creams can thin your skin when we use them for a long time, so not just in the tush but anywhere. So they should be used with a little bit of caution. Another simple remedy is a sitz bath. Basically sitting in a few inches of warm water for about 15 minutes a few times a day. A sitz bath is an easy way to help with hemorrhoids by using warm water to reduce swelling and relax the muscles around your bottom. People with bad hemorrhoids often have tight muscles in that area, and warm water can help make those muscles less tight. Sitz baths can help stop itching, irritation, and help the muscles feel better. You should use warm water, not cold, and try to do it 2 or 3 times a day. You can even get a small bowl to use at work if you need to. However, sometimes, despite your best efforts, hemorrhoids get worse. You've been trying the home treatments, things aren't getting better, you've got severe pain, we've got bleeding that won't stop, or maybe a prolapse hemorrhoid that won't go back in. It is time to see your doctor. They can offer other treatments like rubber band ligation, where a small band is placed around the base of the hemorrhoid to cut off its blood supply, and in more severe cases, sometimes surgery is needed. So there you have it, a quick rundown on hemorrhoids and how to handle them. Remember, hemorrhoids are super common and usually not a big deal. But if they are causing you discomfort, there is no need to suffer in silence. There are plenty of things you can do to feel better. So thank you for joining us today. Our healthcare team I hope that you'll join us next time. Bye-bye.